Good afternoon, my name is Saida Gonzalez, and the purpose of this video is to demonstrate the insertion of a Foley catheter on a woman, female. Okay, so the first thing that I'm going to do is to check the patient's chart and make sure that she has an order for it. Her name is Anna Pawlowski. Her date of birth is May 5th, 1957. She has allergies to penicillin. The reaction on that is hives, and she does have an order for an indwelling Foley catheter. And I'm going to go ahead and I'm going to go to her room. Hi, Ms. Pawlowski. My name is Saida Gonzalez. I'm going to be your student nurse today, and I am here to insert your indwelling Foley catheter that your doctor has ordered for you because you have issues voiding. You have issues going to the bathroom, okay? So, do some hand hygiene. And the first thing I'm going to do is make sure that I am with the right patient. So I am going to see her armband, and I'm going to ask her her name and date of birth. Anna Pawlowski, May 5th, 1957. That is correct. Do you have any allergies? Yes, to penicillin, and the reaction on that is hives. Perfect. So this is her. She has stated her allergies. Okay. I would ask her if she has any questions for me before we start. I want her to be comfortable before the procedure. I'm going to ask her if she's had this before, and if she does, if she's any reaction, adverse reaction in that. If that's the case, then I have to call the physician and make him aware of the situation. But for the purpose of this video, she's never had this before, so she is okay. So next thing we're gonna do is we would raise the bed to a comfortable level for me, but I can do that with this bed, and I would lower the rail just so I have a better access to her. Okay, so I make sure that I have all of my equipment, which includes my tray, my gloves, tape, hand sanitizer, an extra pair of sterile gloves just in case, and I have here some washcloths to do some perineum care on her. Okay, I'm gonna close the curtain. Say this is the curtain. I'm gonna close it, and I'm gonna close the door for privacy. Okay, so once we've done all of that she feels comfortable with it, I am going to perform some hand hygiene, and I'm gonna put my procedure gloves on. And now I'm going to expose her, and I don't want to expose her more than what she needs to. So I'm gonna come from here, and I am going to expose you now, Miss Pawlowski, okay? I'm gonna fold it like this, and I just want her upper body to be covered and only exposing like from waist down. There we go. Okay, I want you to be relaxed. Now what we're gonna do is we're gonna position her in a dorsal recumbent, which is basically having her laying down on her back like this, but we're gonna flex her legs. So legs are gonna be flexed like this, and I am going to expose her vagina. Okay, so before we start, it's required sometimes to perform some clean her before inserting her catheter. And for that, well, it all depends on your institution. Some institutions might require you to use a special wipe. Some others will be okay with washcloths and water. So for this video, that's what we're gonna do. We're gonna separate her labia, and we're gonna localize her urethral meatus, and then we are gonna do some hand hygiene from top to bottom on one side. Top to bottom, we're going to use another part of our washcloth on the other side, and then top to bottom in the center, and we're going to dispose of this. Okay, hospitals usually have like linen bags where you can dispose of that stuff. Gloves off in the trash can, and hygiene. Now that we've done that, we are ready to do our procedure. So what do we have here? We have our tray, all of our stuff in here. So we're gonna take our tray out of the back, put it here. Now this bag, we are going to put it like here, on top of the bed, head of the bed, because we can use that as a garbage bag later once we start opening our stuff. Okay, so hand hygiene, we're going to start opening. Always aware that this is, once we open, everything that's in there is sterile. Okay, so we need to keep it that way. And the first thing I'm gonna find in there is the waterproof drape, and it has a shiny part, and that shiny part is the one that we can touch. And then we're gonna put the shiny part touching the bed underneath our patient's vagina. Okay, so because I don't have that much space here for this video, I am going to move my tray a little bit down the bed so I can put my drape, and then I will break it back up. Okay, so the most important thing is that I'm not touching the inside of my tray with my hands so I don't contaminate. So I'm just like moving it down without contaminating. Okay, my tray. And well, I need you to see that I am going to take my shiny drape, my waterproof drape, from my shiny part here with one of the corners, making sure I don't touch it. I'm just touching my shiny part. Okay, and I'm gonna let it go down. I can touch maybe one corner over here, but always touching the shiny part, not touching the inside. And I'm going to put it here, and if it doesn't fit the way I want, then that's fine. Once I put my sterile gloves in, I'm gonna be able to fix it. So that's the second thing that is gonna be on my back, which are my, in my tray I should say, my sterile gloves. So now I am going to put my sterile gloves here so you can see how I'm doing it. Okay, and I'm gonna put it on this table. Just wanna make sure that, okay, so I open them, and I'm gonna touch only the corners here of this paper, exposing now my gloves. Okay, I'm not touching my gloves, I'm just exposing them. I'm gonna do my right glove, my right hand first. I'm gonna touch the inner portion of my glove. Okay, and I'm gonna first glove, it's in, and then I'm gonna take with this hand my outer part of the second one like this, and then I'm gonna put my hand in, making sure, and I have my gloves on. Now I don't need this, so I'm with my leg, I'm going to move my table, and now I realize my hands are sterile. I can touch the inside of my tray because that's sterile, and my hands are sterile as well. So now I can move this, move it. I can fix this, making sure that my gloves don't touch anything but my drape. I'm not touching the linens. I'm not touching anything. Just touching my sterile part. Okay, same with my tray. And I have my tray here. I can touch whatever I want on my tray because my tray is sterile, so are my hands. Okay, so the next thing I find in here is my fenestrated drape. And this one has a hole in it. Okay, and this is where I'm gonna put my patient's vagina, so I have access, and making sure I don't touch anything but my drape. Okay, so basically I have exposed my what I need to work with. Okay, so now I'm gonna open my tray here, and I just make sure that I have all my necessary equipment. I have my Foley bag right here, which I am going to make sure that it's clamped. I can touch it, I can open it, and it's closed and clamped. It has a covering in the tube. Okay. I have my hydrogen peroxide. I have my lubricant. I have my syringe, 10 ml syringe. I have my cotton balls. I have my forceps. So I have everything in here. Okay. So what I'm gonna do now is I'm gonna open this hydrogen peroxide and I'm gonna pour the content in my cotton balls. So for the purpose of this video, I'm not gonna open it, but I will be doing it. And then this is dirty, so I'm gonna place it on my garbage bag that I just put there. Now I'm gonna open my lubricant and I am gonna place it here. Okay, that's garbage. Now I'm going to take my Foley bag and the covering. I'm gonna take the covering out. So how I'm gonna do that, I'm gonna roll this part because this is very flappy and I don't want this to go somewhere else. I want it to be in my sterile area. So I'm just gonna roll it with this hand while I take the covering out. And it's out. This is trash, goes in the bag. And the tip is going to go where the lubricant is. Just want to make sure that the tip is in the lubricant. Now I'm going to grab my 10 ml syringe. I'm going to take the cap off. Trash. And right here, I'm going to connect it. Making sure that it's properly connected, and it is. All right, so the next steps are the most important steps. I am going to use my non-dominant hand to touch my patient's vagina, and now I need to realize that this hand is going to be contaminated and I cannot touch anything from my tray once I touch my patient with this hand. So what I'm going to do is I am going to open her labia and expose her urethral meatus, and I'm going to clean that area with the solution that was in the tray using my forceps and my cotton balls. Okay? Okay, do it. Now this hand is contaminated. I am going to use my forceps, one cotton ball, and I'm going to go one side of the labia, top to bottom. That is dirty. I'm going to use another one on the other side, top to bottom. That is dirty. And then I'm going to use one more for the center. That's all dirty. All right. So now what I'm going to do is I'm going to take the tip of my Foley catheter, about 3 to 4 inches, and I am going to insert it. Okay, so deep breath, Miss Velilowski, bear down, and we're going to go in, just making sure that she knows that we're about to go. Okay, and there we go. If I and I'll go 2 to 3 inches down or until I see urine. Okay. Let's say I see urine now. coming down. So I'm gonna go ahead, I'm gonna go 1 to 2 inches more. Once I do that, I can release my contaminated hand and I can just hold it there. And then with this hand, I am going to insert my 10 ml syringe, which is basically what it's going to do is going to inflate the balloon that's inside, and it's going to hold my catheter in place. Okay, once I've done that, I can release here, and then I can just take my syringe out. Okay, and I can gently pull this down until I can no longer do it, which basically means that my balloon was filled up and that my catheter is in place, okay, inside of her bladder. So now I can take all of this stuff away. And I am going to take this out. You want to tear it, you want to break it, but I'm not going to do that for this video. I'm just going to take it out. But in a real environment, you just want to break it and throw it away, okay? So now what I'm going to do is I'm going to put her in a comfortable position again. And this, I am going to tape it to her thigh, okay? And I don't want to be super straight that create tensions and can cause her injury. I just want it to have some space. So if she moves, it doesn't cause any injury or any pain. Now this one, I'm going to use my tape. And then right here, usually hospitals have like a special attachment, and the tape is really hard, really sticky, where you can put all of this, tape it to the patient's thigh. Once I've done that, I got my Foley, and it is very important to position your Foley bag below the patient's bladder, so somewhere on the bed. Hospital beds, the frame, they have like hook and stuff that it is very easy to attach this to. The most important thing that you need to know is that this have to go in a non-movable part of the bed. So you don't want to put it on the bed rail, just want to put it maybe on the frame, and always below the patient's bladder. So once we've done that, we can just cover our patient again. Make sure that she is covered, that she's comfortable. You want to take all of your stuff and you want to throw them away. You want to throw them in the trash. Okay. Trash, trash, trash. Okay. You're gonna perform hand hygiene. And you want to document the insertion of the Foley catheter, the size of the Foley, the amount of sterile water that was in the syringe, how much urine you get out, the clarity, and the color of the urine. So all of that is required to document in her chart. You want to lower the bed, make sure your patient is comfortable, make sure she's not in pain. Like I said, get rid of all of your trash. Put the rails up, her call light within reach. Make sure her room is safe, and if she has any questions, you can answer her questions, and if not, then you would open the curtain, open the door, and leave, and check on her frequently. So that was it. Thank you.